Alright. For week 7, I did chapter 12 of the counseling interview. And first step is preparing for the interview. You want to assess what you can do as a counselor, kind of what your skill set limits you to. You want to be calm, and you don't want to argue with the interviewee in this sense. You know, create a hostile environment. You don't want that. You got to realize what they're looking for, or you got to figure out what they're looking for in the interview, and their wants and needs as a client. And you want to focus on helping them you want to look at them as a person, not as a obstacle. In analyzing the interview, you want to learn everything you can about who you're interviewing before the interview even starts, so you can try to find out what the problem actually is, or at least what might be some of the causes of the problem, see what's going on with their life. There are 2 approaches to this. The first is the direct approach, and this is where, as the interviewer, you introduce the topics and kind of set the pace for the interview. But when you're using this method, you want to be careful not to push too hard and try to make the respondent say anything that they're not comfortable saying yet. And the non-direct is the next approach, and that's where you let the interviewee set the pace for the interview and kind of let them control the topics, and you just kind of listen to them at the beginning. And the third view is kind of a combination of the both, where as the interviewer you introduce the topics and give them more and more control as the interview goes on. The next thing you need to think about while you're preparing for the interview is where you're going to hold it. You want it to be a private location. You don't want any distractions, especially not like a cell phone or anything like that, or someone coming in the room. It needs to be private. And you want the room to be arranged in a free manner. Like, sitting behind a desk kind of sets a bad vibe. It creates distance between the interviewer and the interviewee, and can impede the information getting processed. But when you're doing this, you need to make sure you're not trying to make them say or do anything just because that's to your liking. You want to leave them be, but just help them with their problem. When you're opening the interview, excuse me, you need to, you want to greet them in a warm manner, you know, hi, how are you, how have you been, and so on. And don't say anything too drastic. To start, you want to be neutral and kind of accepting of what they're saying, and you want to let them know that you're interested in helping them find the root of their problem, or help them find a solution to their problem. And you need to kind of discover what kind of thoughts and feelings they have about what's going on. The body of the interview, you want to kind of explain to them that the problem is normal, like everything's fine, these things happen, and what they can do, what you can do as a team to find a resolution to the problem. You need to offer them maybe explanations for what they've been doing, like why they've been doing what they've been doing, or why they're acting this way, and kind of provide them with alternative actions for what to replace what they're doing. The closing of the interview is you want to try to assess how the interviews went, and you want them to you want to make sure it's a positive feeling when they're walking out of the room. Make sure they know they're welcome back. These interviews don't always take place in a regular interview setting. Sometimes they can take place over the phone, and when they take place over the phone, it's actually been rated that these interviews are very close to having an actual face-to-face interaction, and the information getting processed can sometimes be better because there isn't that face-to-face presence, or sometimes the embarrassment that some people have with problems. Doing these interviews over the phone kind of provides for some anonymity. Then after the interview's over, you want to evaluate the interview, go over what took place, what your thoughts and feelings are about what's going on. Tell them, make sure you told them all the options that they have, and make sure they understood them wholly and accurately. And you want to evaluate the kind of responses you gave them to their questions, and the thoughts and feelings you gave them about why what is happening is going on. You want to focus on the respondent only when you're conducting the interview, and if they're telling a story, don't interrupt. Don't check your phone, email. Sometimes you think of a counseling interview, a counselor will be writing things down. When they're doing the interview, it's more prevalent now to just record the sessions, because writing things down would adversely affect the interview process. And you want to watch the nonverbal communication that you're showing them. Make sure you're forward, make sure you're interested, not slouching in your chair or checking your phone. Things like that are very detrimental to the interview. And during the interview, you don't want to just ask yes or no questions. You want to ask open questions so they can kind of reveal the ideas in their entirety about their affliction. When you're responding to the interviewee and kind of giving your ideas on what's going on, you want to focus on what the client needs and what kind of options they have, and you want to clarify these ideas after you've given them these ideas. Ask them about what you've said, so there aren't any misunderstandings, and you want to respond to their negative thoughts more than their positive thoughts, because the negative thoughts are what the work is based on. When responding, there's a couple different approaches. The first is the highly non-directive approach, which the interviewer doesn't really give their thoughts and opinions in this approach. They might start with an open question and use a silent probe or a nudging probe to get the respondent to reveal ideas more deeply. And the next is just the non-directive approach, and that is closely related to the highly non-directive approach, but you will give some ideas. You want to encourage the interviewee to take actions themselves. Any responses that you do give need to be specific to the problem at hand. Don't make your answers vague. The next is directive reactions, and this allows the interviewer to give information about the subject and kind of the judgments of the actions that the client is doing. Ask questions about their behavior. Ask questions about what they think the cause is, and you want to promote other actions for them to change. And the last one is the highly non-directive approach. This is only if the other approaches don't work. You don't really want to do this. You kind of have to not quite force the client to do anything. You don't want to force them or make them or lead them to believe that they have no options, but you might present them with an ultimatum that if they keep acting this way, or if they keep making these actions, then you might quit helping them if they're not willing to fix their behavior or at least work on it.